My name is Simon Ndirangu from Kenya Medical Research Institute, Kilifi, Kenya. So today I'm going to talk about occupational health and safety in a research setting. So there's a huge burden in many resource-poor countries in Africa and other parts, and most of these countries, they are gaining rapid achievements in biomedical research and science. And many clinical trials nowadays are being done in Africa, and this includes trials on malaria and HIV/AIDS and other bacterial infections such as TB. So clinical trials which are performed in countries which are different from that of the sponsor may have some limitations in terms of resources and other healthcare inequalities. So researchers must make sure that when they conduct research in these places, they should ensure that they attain the best health and safety standards. So when you are working in a research setting in biomedicine, there are various physical and chemical hazards that you may come across. There might be also other hazards which are related to the research protocol. And in some cases, some people might be allergic to chemicals which are used in some research laboratories. And you may also encounter some blood-borne pathogens and diseases such as malaria, HIV/AIDS, and hepatitis A, B, and C, or syphilis. And this one, you can acquire them in the course of your work. So it is important to have a health and safety program in place, and this will enable you to recognize the hazards and risk and do risk assessment. And if there are accidents, you need to find how ill health can be prevented. And this is for various reasons. One, for legal aspects. Then people have to be responsible, and that includes the employer and the employee. So we need to have occupational health in place. You do health assessment. You also need to provide first aid and training, and also fire safety precautions and action in case of fire. If you have a good, effective occupational health program in place, this is going to be important because it can reduce work-related injuries and illnesses, and this is going to lower medical care costs for the employees who may be participating in the study, and this will lead to savings on limited resources, so you can use those for other research needs. And it is also going to improve the morale and productivity of the employees, and also reduce compensation in case somebody is injured during the study. You don't have to pay if you had good occupational health and safety programs in place. So there are several elements of an occupational health and safety program, and these include commitment by the management and employee involvement, workplace risk assessment, hazard prevention and control, and occupational health and safety training. And these must be part of the research program. It should not be taken as if it's something which is separate from the routine research. So for a successful occupational health and safety program, there must be strong commitment from the administration. The second thing, you have to implement sound strategies for implementing the occupational health and safety program. And then you have to have effective coordination of the program, because you might be working with various people in the program, and everybody should know what is expected of them. The management and the employee should have commitment, and when management has commitment, this is going to provide motivation and resources. Employee involvement is going to allow the employee or the person who is working in the research program to develop and express commitment to occupational health and safety. And these roles are complementary. They are not separate, so they have to work together. The other thing is that you've got to have a health and safety policy in place. This is going to state clearly what the workplace health and safety policy is, and then you have to establish and communicate a clear goal and objective for the health and safety program to everybody, so that everybody who is in the research program knows what is expected of them. And then it is very important to involve top management in implementing the program, because if you don't do that, it's not likely to be successful. There is also the employee has a part to play in this. So you have to encourage the employees to get involved in the occupational health and safety program, and you also have to involve them in making decisions that may affect their own health and safety at work. You also have to communicate this responsibility for all occupational health and safety programs. So you have to be clear who is responsible for what in implementing the program. So there are various roles and responsibilities in occupational health and safety, and the parties, all the parties that are responsible for this program must have necessary resources, and these resources must come from the administration. And also, as a researcher, you have a part to play, because in most of these places, the countries have limited resources. So as an investigator, you have to be prepared to contribute towards meeting some of the costs. Occupational health and safety program operations must be reviewed at regular intervals. So when you start the study, you need to identify what is required, and some of the studies take a long time. They might take 2, 3, 4 years. So you have to review them along the way and find whether you need to revise them or you need to add something else. The principal investigators, in most cases, these are the people who have the funds to do the research. They also have an important responsibility. It is their duty to ensure that the occupational health and safety rules and regulations are complied with where they are doing the research. In some cases, the research is done in some rural parts of the country, far away from the main research laboratory. So even those satellite sites, you have a responsibility to ensure that the work is conducted in a safe manner, so that the employees are not exposed to unnecessary risks. And the principal investigator must cooperate with the laboratory manager or clinical site manager or supervisor and the employees to ensure that they develop and implement additional policies and procedures that may be needed to support occupational health and safety programs in their research areas. Because in most cases, the research is conducted in a big laboratory or clinical setting, so you have specific duties as a PI to ensure that those policies are followed and specific ones are also implemented. Employees are responsible for day-to-day, because as an employee, you are the one who is doing the work and you are the one who is exposed to the risk. So it is your duty as an employee to ensure that you implement the occupational health and safety regulations as part of your work. This should not be viewed as separate. And all employees having potential exposure to blood-borne pathogens and other potential pathogens, they have to understand the risks which they are exposed to. They should conduct those tasks in accordance with the practices which are outlined in standard operating procedures, and they should attend any courses or training sessions which are offered, and they should also practice good personal hygiene habits. So we need to do risk assessment and also hazard control. So what is the objective of an occupational health and safety program? The main purpose or the key objective is to reduce to an acceptable level the risk associated with using materials or systems that may have inherent danger by controlling or eliminating the hazards. In some cases, it's not possible to eliminate the risk. There will always be a risk because if you are working in a clinical setting and you are dealing with the patients who might have infectious disease, you cannot control that. You cannot eliminate the risk completely, but you can control it. So that is what you have to aim for. For risk assessment, how do you do it? Risk assessment is important in that it is the foundation for progressive occupational health and safety. So it is not a one-off thing. It's something which you have to do on a routine basis. It is also important in selecting appropriate healthcare services for your staff. So if you have some people who are working in your project or in your clinical setting, you need to provide them with medical care. And once you do risk assessment, then you know what is required and what you can avoid. So what is risk? What is risk? Risk is the likelihood of a consequence. And what is risk assessment? It is a measure of the likelihood of a consequence, and it is a way of defining and quantifying a hazard. So you may ask yourself, when can I stop defining and quantifying hazards? It is a dynamic process. This is something which goes on and on as long as you are involved in an activity in a research setting. So you can never complete it. You have to do it all the time. And then you may ask, whose responsibility is it to identify hazards in the research or laboratory setting? The first thing we have said, the principal investigator, thus he has a duty to ensure that the occupational health and risks and hazards are identified. Then the facility management, these might be the people who own the place or those ones who are employed to run it, like the program director or manager and so on. And then the healthcare providers. We assume that in such a setting, you have people who will be attending to your staff so they can advise on some of the things which might be risky. And the employee. And the employee has a very important responsibility because they are the ones who are exposed on a daily basis because they do the work. So in summary, we can say that the responsibility here for risk assessment is for everybody. Everybody is responsible. The management has responsibilities, and these are to recognize the hazards of each activity, assess the risk in each hazardous activity, and control these risks. So the management must ensure that any existing hazards and risks associated with the research activities are identified. The conditions and operations or research activities where changes might occur to create additional hazards are also identified. You might start doing some research along the way. You may also change some of the things you are doing, and that might bring additional hazards. So the management must also actively analyze the research work activities and the research site to anticipate. They have to expect and prevent harmful or dangerous occurrences. So this is a proactive process. You don't have to wait until the things have gone wrong. Supervisors, these are people who are in charge of supervising the employees. They have to analyze work to identify potential hazards in workplace or area of responsibility. They have to maintain physical protection in their work areas and reinforce employment training through performance, feedback, and enforcement of safe work practices. And that's on a daily routine. You have to do it all the time, every day you are involved in an activity. And as an individual, as an employee or anybody else who is involved in the research, you have your own responsibility. You have to assist in hazard recognition, contribute to risk assessment, implement control measures, and avoid being negligent, because most of the accidents which happen are because of negligence on the part of the person who is working. You also have to identify the hazards. This is risk assessment process is a process. Identify the hazards, identify those at risk, evaluate the risk and implement controls where necessary, record your findings and review the assessment. So those are the 5 steps which you have to follow. Hazard control, to prevent and control hazards, you have to use engineering controls. These are things like fume hoods and so on, biosafety cabinets. And then there are administrative controls. Administration may place some requirements, some rules and regulations. Then personal protective equipment is very important. It has to be used all the time. Safe work practices, this has to be communicated to the staff through training. You have to train your staff. and positive reinforcement. So where they are doing right, you encourage them, and when they are not doing things in the right way, then you advise them and you discuss and see what can be done. And you can also correct unsafe performance, and you also have to implement strict enforcement on following occupational health and safety regulations. You also have to conduct health and safety inspections at your workplace, and this should be regular, and it's important that you decide on how often you need to do it. You can do it every week or every month. And the idea here is to establish those hazardous activities early enough so that you can make corrective action. So you need to develop and use a health and safety checklist. So if you have this, you go around and you can be able to be ticking and checking what is right or what is wrong. You also need to establish a reliable system for employees to notify management about apparent hazardous situations without fear of appraisal. So if somebody reports that something is wrong, you have to assure them that they are not going to be victimized for reporting that, so that they can have your confidence and they can do it. And also you have to give the employees timely and appropriate responses to their concerns and queries. So if there is an issue about something which is not safe or that might endanger their health, you have to tell them what you are doing about it. If you don't do it, then this may lead to other problems. You also have to report to ensure that any accident or incident that happens at your workplace is reported and documented. An accident is something which actually happens. Let's say somebody was taking a sample from a patient and they pierced themselves with the needle. That's an accident. Or it can be a near miss. This is something which almost happened, but it didn't happen. And it is important because these near misses are the ones which are going to give you direction on what is likely to happen, so you can be able to address them in time. So once you have these accidents, you identify their causes and means for prevention. And then you analyze any injuries that may happen at work so that you can identify any threats and also patterns, and then you are going to be able to implement preventive measures so that you are going to control future incidents or accidents. And you also need to have occupational health and safety training at work. You have to address the occupational health and safety responsibilities of all the people who are involved in the study. You also need to incorporate it into other training and job performance. So make sure that when you are training people on what to do, you also include the occupational health and safety training so that people can know it's part of their job. It's not a separate thing. And when you get new employees who might join the study team, you have to give them orientation or induction. They must understand the hazards that they may be exposed to, how to prevent any harm to themselves and others from hazard exposure. So orientation is important, and this should also be given to other visitors. There might be people who may come to visit your study site or your lab. You also need to tell them about this. And also, there might be other people who are just working to work in the lab to repair the equipment and so on. These are also included. So you are responsible as a PI or the manager of all these to ensure all these are in place. In summary, we can say that effective occupational health and safety programs, they are going to reduce work-related injuries and illnesses. They are going to improve motivation and productivity among the staff. They are going to reduce workers' compensation costs so that if there are no injuries, then you are not going to pay to compensate for those. They include 4 key elements, and this is management have to have commitment, employees have to be involved, workplace risk assessment has to be done, hazard prevention and control measures have to be in place, and health and safety training programs have to be done throughout the study.